All right, so let's look at this case of Bacchus. So Bacchus is a middle-aged mixed breed dog that presented for this inability or reluctance to put down the right back leg. Anytime he put it down or you manipulated it, he would scream as if it was extremely painful. But he had an orthopedic examination, and the orthopedic examination showed no abnormalities. When we did a neurologic examination, you could see that there was decreased tone in that leg. Reflexes were surprisingly normal, but any manipulation, particularly at the level of the hip, caused all this discomfort. So what we elected to do was a CAT scan of his lumbar spine, and I wanted to share that with you here. So this is the lumbar spine CAT scan, and what you can see when you first start looking at it right away is that there is this malarticulation at the lumbosacral joint. So this is L5, this is L6, this is L7, and this is the sacrum, also known as the tailbone. This is the ilium and the ischium, so the pelvis here, and then these are the back legs as they come out. This is the head of the femur. And so for those of you that don't look at a lot of CAT scans, what you'll notice is look how nicely this caudal articular process of L6 interdigitates with the cranial articular process of L7, and that's called a facet. Beautiful. Well, now let's look at the caudal articular process of L7 matching up with the cranial articular process of the sacrum. Look how displaced that is. And the consequences of that I'm going to show you here in a moment. So when I remove the pelvis, it enables us to look at everything from the side. And when I look at it from the side, all of a sudden you can see why this would be so uncomfortable. This is uncomfortable because if you look right there, you see where the nerve root comes out between L5 and L6 or L6 and L7, and that's normal. But when you look down here, look how it's getting crunched or guillotined. So that is essentially causing a really nasty form of sciatica. And there's some other diagnostics we did that I didn't share with you, but I'm going to show you why this has happened to Bacchus. So I'm going to take out more of what of that CAT scan, and now let's look at it from the side. What you can appreciate is that the bone has been completely eroded inside of L7 and the entire end plate of the sacrum. So this is a very severe case of lumbosacral discospondylitis, so much so that it's causing pain not only from the destruction of the bone, but it's also causing pain because of collapse and compression of the foramina. You can even see it here on the other side. You can see how the nerve root comes out right there, no problem, and here it's getting crunched. So treating the underlying infection, although important in and of itself, is not going to resolve the. So to make Bacchus more comfortable, in addition to doing antibiotics, which would start resolving the infection and the loss of bone, we had to put the vertebra back in a position where you got less compression of the nerve root, and that requires spinal stabilization. So here you can see the use of a new form of construct that's not super new, but it's definitely revolutionized the way we do spinal stabilization or stop the vertebra from moving in inappropriate locations. This is a polyaxial screw and rod system from a company called Artmedics, and you can already see the benefit of it. So if I were to zoom in on it, what you're looking at are the two individual screws in L7 and the two individual screws in the sacrum, and you can see, like I alluded before, now you have the cranial articular process of the sacrum or the tailbone articulating with the caudal articular process of the L7, and that is the way we want the facet to be oriented. And the value in that, when we start to cut this away, like we did with the previous image set, is you can see that now a lot of that foramina has been opened wide up. You see that? How you have the foramen open here and here, and now it's here. So that nerve root is coming out without being pinched. You can also see the value of the polyaxial screw and rod. So here's the screw, and the screw has this little tulip on top that can move in all different directions and accept this rod. And once that rod is in place, it all gets cinched down with what's called an end cap, and then this is a brick. What's exciting about this is it's moved us away from using cement. It's less likely to get infected, and if you ever have to revise it, you can do it with minimal effort. And the video of Bacchus after he's come back from complete recovery, so here he is, feeling really good a couple months later. And we've completely resolved the infection at this point. So it just speaks to the fact that discospondylitis is often a medically treated disease where we alleviate the pain associated with bone destruction. But if there's been pathologic fracture or bone collapse that leads to compression of nerve tissue, often we're relegated to positioning the spine in a fused position. And despite the fact that infections love to hang out in implants, sometimes it's a necessary evil, and the polyaxial screw and rod really has opened up new opportunities.